Welcome to today's webinar, Common Errors to Avoid in Your X-ray Plan Application to the Ontario Ministry of Labour, Immigration, Training and Skills Development, or MLITSD. Our guest presenter today is Matthew Caldwell, Professional Engineer at the Radiation Safety Institute of Canada. My name is Lynn McDonald, hosting on behalf of the Institute. Before starting, we would like to acknowledge that the spaces in which we at the Institute work in Toronto are located on the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Fergal Nolan National Laboratories in Saskatoon is located on Treaty 6 territory and the homeland of the Métis people. We thank them for their care of the land and pay respect to them and their ancestors. We ask that during the presentation portion that the audio and video be from the presenter only. To turn on closed captions, go to More, Language and Speech, turn on live captions. Please use the chat feature for any discussions and post questions arriving from the content in the Q&A. This will help us to find your questions for the allotted Q&A portion while allowing people to have a conversation in the chat. If you do not see the Q&A, please type your questions into the chat and one of us will do our best to copy them into the Q&A. As the webinar is only 40 minutes in length and is immediately followed by our wellness session, time may not permit for us to answer all of them during the webinar. The answers will be posted on our website along with a link to the video recording and a copy of the slides. These can be found under Education Webinars. I will be sending a confirmation of attendance email after the webinar and will include a link to that page with that communication. I will also include the topics covered and the length of time spent in the webinar, as some people have requested this to send to their professional association. The webinar will begin with a brief overview of how X-ray equipment is regulated in Ontario, including the requirements around registration. Matthew will then give examples of errors to avoid when making an X-ray plan submission to the MLITSD. There will be a Q&A as time permits. Additional resources available from the Ministry and the Institute will be noted. The final 20 minutes of today's hour-long webinar will be a movement break led by Charmaine Wong of Jihong Tai Chi and Qigong Richmond Hill. We would like to make the disclaimer that the material provided here is not legal advice. We take no responsibility or liability in the application of the content. The content is correct for Ontario at the time of the webinar delivery. Note that we will not be giving specific plan advice. So let's move into the content. X-ray sources operating at energies above 1 megaelectron volt are within the jurisdiction of the Canadian Nuclear Safety Commission, or CNSC. Lower energy X-ray sources fall under the jurisdiction of provincial or territorial governments, or Economic and Social Development Canada for workers in federally regulated workplaces. In Ontario, worker safety with respect to X-ray sources falls to the MLITSD. The applicable regulations are found within Regulation 861, X-ray Safety of the Ontario Occupational Health and Safety Act. For X-ray sources that are used for human health care in the province, some sections of Regulation 861 do not apply, but those sections, including the requirements for registration, are covered in Regulation 543, X-ray Safety Code, under the Healing Arts Radiation Protection, or HARP Act, enforced by the Ministry of Health, or MOL. To clarify who must register their X-ray equipment with the MLITSD, we have to first look at the definition of X-rays. Electrically generated electromagnetic radiation of maximum photon energy not less than 5,000 electron volts. If the maximum energy is below this, then Regulation 861 does not apply. While we are going through definitions, Ontario makes a distinction between an X-ray machine, an electrically powered device, the principal purpose of which is the production of X-rays, and an X-ray source, any device or that portion of any device that emits X-rays, whether or not the device is an X-ray machine. Within these definitions, along with a bit more information, we can determine what workplaces Regulation 861 applies to, which is every workplace an X-ray machine is used, or if an X-ray source is capable of depositing enough energy into the air to cause an air coma greater than 1 microgray per hour at any accessible point on its surface. It does not apply if the X-ray source is licensable under the Nuclear Safety and Control Act, that is, over 1 megaelectron-volt in energy, and, as stated before, certain sections, including registration, are not applicable if the X-ray is being used for human health care. Section 5 of Regulation 861 is where the requirement for registration is found. The employer must use a form obtained from the ministry. If the workplace ceases to have an X-ray source, they must notify the ministry, and then the registration will be terminated. There is a subsection grandfathering in registrations before 1986, not shown on the slide. There are several prescribed requirements for the plan location drawings that must be submitted along with the application form. The drawings must bear the name of the applicant and the address of the location, be on a legible scale that is not less than 1 to 100 and that is suitable for microfilming, indicate the direction north, show the proposed location of the X-ray source and, where applicable, the range of its motion, show the proposed location of the X-ray control panel if the location of the control panel is different from that of the X-ray source, indicate the use of rooms or areas that are adjacent, both horizontally and vertically, to the proposed location, indicate the type and thickness of the shielding installed or to be installed on the boundaries of the proposed location, and indicate the type and location of the safety devices such as warning lights, interlocks, and cutoff switches. If the X-ray source is portable and mobile and being used in that way, floor plans are not applicable. Rather, written notice needs to be given to the ministry that include the name, address, and registration number, if any, of the employer, the location where the X-ray will be stored, the purpose for which it will be used, and the make, model, serial number, maximum operating voltage, and maximum operating current of the source. Now that the context has been given, I will introduce today's guest, Matthew Caldwell, P.Eng, here at the Institute. Matthew joined the Institute's team in 2017. He received a bachelor's degree in engineering from McMaster University. Matthew holds a professional engineer designation with Professional Engineers Ontario. He has been engaged in X-ray installation plan reviews in various capacities. He is highly professional, detail-oriented, very knowledgeable, and a trusted member of the review team. Before working on X-ray prime reviews with the Institute, Matthew has supported the delivery of Alaware Incorporated services, including developing a system for calculating radiation shielding requirements for the implementation of medical X-ray systems. And now I'm going to turn it over to Matthew.
Okay, hello everyone. Good afternoon. Thank you, Lynn, for the wonderful introduction. I am Matthew Caldwell, project engineer here at RSIC. I've worked with X-ray applications for Ontario for about 8 years now, and I'm hoping to provide some helpful information for those trying to navigate the X-ray application process. I will first be going over the form Ontario 00057E. Sorry, let me just mute these.
Athena and I'll keep an eye on the chat.
Yeah. So I'll be going over the form for a typical Ministry of Labor X-ray application, along with the requirements for creating the floor plan to accompany that application. I will not dive deep into the form itself, but I will only highlight a few things that may not be obvious for a first time or even an experienced submitter. If you wish for more of a deep dive, you are welcome to follow the guidance page on the ministry's website itself, or even RSIC's own website. We do have a full document explaining various parts of the application process. These resources will be linked at the end of the webinar, so no need to go searching for that right now. After I go through the form and floor plan expectations, I will highlight common mistakes I have seen in both documents. Once I have finished this, there will be the Q&A session, which if any questions come up or if you just have general questions about X-ray applications, you can save that for then. All right. So for the next two slides, I'll show you form Ontario 00057E. Don't worry if it's a little blurry and hard to see. We're not really going into too much detail, and I will try to provide a clear image. No, I'm not on mute. Is someone having sound problems?
We're able to hear. Sometimes if you hop out of the meeting and back in, that helps with Teams. So if you're not able to get it to work, just try popping back out and back in.
Yep. Okay, back to the meeting. Sorry about that. So jumping straight in, so this form, you should consider it as a legal document. So all information you enter into it should be as accurate as possible to the best of your knowledge. Avoid spelling or typo errors and fill it out to the best of your ability. The first part I will highlight is the first page, section 1, applicant information. This is a key part of the document simply because this is where you state your information, right? Specifically sort of the ownership of the X-ray source, the registration itself. If you were to enter the wrong information here, you've now registered under the wrong name, the wrong address, and therefore your application itself would be invalid. Please note, obviously, the business address you can see there. There's places for the street number, the unit number, the street name, the street type, the street direction, city, town, postal code. Pretty straightforward, right? One thing that I find catches a lot of people off guard is that interesting sort of small sections called street name, street type versus street direction. This is not necessarily as straightforward as many would like. The ministry itself is not very picky on how you fill this in, but obviously there's differences between a street name, a street type, and a street direction. For example, here at the Radiation Safety Institute of Canada, we are located at 100 Shepherd Avenue East. So the street name itself would be Shepherd. The street type would be Avenue, and then the street direction would be East, and I would fill it out as such. However, obviously the ministry is not going to be picky if you just put in the entire street name in the street name subsection there. But obviously it's great to be perfect if possible. Please note on all legal documents, just like this one, note the positioning of the last name versus the first name entry boxes. This is a mistake a lot of people make, myself included, when filling out legal documents, right? You put your last name in the first box, first name in the second box, and that can be a common error that you wish to avoid. Another thing to note about this section is that the business address is not necessarily your X-ray source location address. So you could have a facility where you're installing an X-ray at one site, but your actual ownership of the application may be at another site that you want to register it for. I'll give you an example. We have the University of Health Network here in Toronto. Hello to anybody who's watching from UHN, welcome. For example, let's say your headquarters for UHN is the Princess Margaret Cancer Center. You would put that information here in section 1. But you're going to be installing the X-ray source in, let's say, Toronto General Hospital. You would put the Toronto General Hospital address as your X-ray facility address, and which is later on in the form, which you'll see later. Another section I will highlight here in this call is the applicant notes to reviewer, top of the second page there. This is an optional section, so you're welcome to leave it blank. However, I would say it is a great way to provide additional context regarding your application to reviewers. If you have a special case, or maybe this is just a minor revision to an existing approval, you could provide an explanation here, a couple sentences, just so the ministry is aware and the reviewer may be able to better understand your setup. So these are pages 3 and 4. As you can see, there is right in the top left is where you'd enter your X-ray location address versus the business address. If it's the one and the same, just tick that little box in the top left there, and you're good to go on that sense. Responsible person section. Though the qualifications may vary, it is important to have someone knowledgeable and competent overseeing the use and operation of the X-ray machine. This person will likely need to have some level of radiation safety training to ensure a safe work environment for your X-ray workplace. The next setting, the ministry nicely gives you all the minimum requirements that Lynn already pointed out for your floor plan right there in case you forget anything we've covered today when you do your actual application. There it is, all listed out nicely for you. We'll go more in depth on that later on, but that's that section. You're also welcome to directly attach your floor plan file. As you can see, there's a little add file section there. You can directly add your floor plan to the form when you're submitting to the ministry. You're also welcome to add any additional documentation you deem necessary. For example, you could provide your X-ray equipment manuals. You could provide documentation on control procedure policies with the X-ray machines. Excuse me. Or even maybe an expanded floor plan to show even farther of the layout of your X-ray clinic. Okay, and then the next section is occupancy and use of surrounding areas. These are occupancy tables. It's something I like very much about these forms because the ministry is providing you default values for your typical adjacent spaces to your X-ray room. For those who don't know, an occupancy rate is how often a space is occupied during working hours or X-ray operating hours, expressed as a percentage or a fraction of the total time. This is an estimation of the average day over a course of a year. So you could spend an entire day in a parking lot, which is listed at 2.5%. But over the course of a year, you're probably not spending a significant amount of working hours in the parking lot itself. These stated rates shown in the table are what are assumed to be accurate, or at least approximate to your shown adjacent spaces, if you do not provide alternate occupancy rates, which is what the next optional section is about. If you know for a fact that your adjacent space does not match the occupancy rate stated in that table, please go ahead and specify the different occupancy rates in this section. This applies whether you have a higher occupancy rate than the default or lower. Both should be noted. And then finally, a very common error, but in the attestation section, this is where you're basically signing off on the form. You're verifying that all the information is accurate as possible. It's an e-signature, so your last name goes in the first box, first name goes in the second box, you date it, you put all your information in. The key thing here is that little check box by that bold text that says, I confirm that I am the employer or am authorized to complete and submit this form as an agent of the employer. I hereby certify that information provided is true and correct to the best of my knowledge. This is a very small error that pops up way too often for any sort of electronic form. You have to check off that box, otherwise the form will not be considered signed. And an unsigned form is an unfinished one. So moving on, I have included this slide for your reference if you ever need to come back and need some guidance on workload calculations. It's pretty straightforward. All the actual information is hard to get because you have to figure it out from your own workplace, your X-ray machine itself, rather than finding it somewhere on the internet. As you can see, workload is maximum current by time per exposure by exposures per week, all divided by 60. The divided by 60 is to get the workload into the units of milliampere minutes per week, which is what the form requires. So these are what I would call my tips for filling out the form. Treat this like a legal document. Typos, misleading, or incorrect information can all make your application invalid, and you could end up operating an X-ray machine without a license. It is important to provide all information as accurate as possible, whether it be the shielding or even just making sure your street address is correct and accurate. Workload calculations and considerations. Are you planning to expand or change your X-ray facility in the near future? You may wish to account for this with possibly stating a workload higher than your expected workload today to give yourself some leeway in the case where you expand and maybe increase the amount of X-rays you're taking per week in the future. You are only permitted to do what the maximum workload you have stated in the form. If you expand beyond that, you would be required to reapply for the larger workload. And of course, if you're ever renovating and changing the entire structural setup for your X-ray machine, obviously that would need a reapplication. Occupancy tables, is it applicable? Like we just covered, if you have alternate occupancy rates, make sure to provide them. These rates do play a factor in accurately estimating the possible radiation dose to the occupants of your X-ray facility. Providing inaccurate rates is not advisable given the importance of this information. Explain any additional control procedures, PPE, etc. Feel free to include any other documents other than the floor plan and form that could provide a better understanding to a reviewer of the X-ray machine, sources that you have included, anything that sort of provides a better picture. They only have your two documents, the form and the floor plan itself at minimum. So anything extra can likely help them review properly. Common errors when filling out the form. Like I said earlier, I'm really emphasizing this one because it is such a minor mistake to be made and that should be avoided. E-signature checked. Check that checkbox once you make sure everything is accurate on your form. Short forms or spelling errors in the employer name, the business name, the responsible person's names. Obviously, here at the Radiation Safety Institute of Canada, it's a bit of a mouthful. We like to short form it to RSIC. However, this should be considered as a legal document. So we're going to write it the full name out on both the form and the floor plan. We're not going to use RSIC as a short form because otherwise this might be significant enough that there could be a dispute in name and the application itself may not be applicable to us after approval. First and last name not correctly filled in. Too often these are flipped, which is unfortunate, right? My last name is not Matthew, but I might fill it in that way. This would mean once the approval gets through, we're approved for someone whose last name is Matthew, not last name Caldwell. This obviously would be an issue and we wouldn't have proper approval for our X-ray source. And then finally, required information not included. Make sure to fill out the form to the best of your ability. All entry boxes marked with a red star should be answered as best as possible. If you don't know, try to find a decent answer or approximate answer. All right, moving on to the second part, creating your X-ray floor plan. You will see some obvious overlaps here with the form details, simply because these two documents go hand in hand. As Lynn discussed, here are the minimum requirements for a floor plan. A legible scale drawing of 1 to 100 or greater. That means between 1 to 1 and 1 to 100 for anybody who gets confused about the greater thing. Not a 1 to 200 kind of ratio. Name of employer and X-ray facility address indicated. Like I said earlier, If you don't have the names proper, your approval will go to an incorrect name, and obviously that will be a bit of an issue because you won't have proper approval. North direction indicated. You do have to be careful of this. It should be matching compass north as much as possible. If your X-ray facility undergoes an inspection and the inspector is not able to clearly map out the X-ray room due to an incorrect north direction, you may be required to reapply or update your current application for your X-ray source to reflect accurate information. Proposed location of X-ray source and its range of motion. X-ray source and travel limits must be explicit on your floor plan. Do not draw a single dot in the middle of an X-ray room and necessarily expect that to be recognized as your fixed X-ray location position. A reviewer is not necessarily going to assume a lot because it's up to you to specify properly. Proposed location of control panel and exposure switch. Your switch location it's an important thing to note here is that you do have to ensure your switch operator is in a shielded position whenever possible. If it is a machine or an X-ray source that does not require the switch operator to be within the X-ray room, your switch location should not be directly exposed to the X-ray source. Have it behind a barrier, a wall, a door. Well, you're probably not going to fix it to a door, but the switch operator should be outside of the room if possible. Adjacent spaces to the X-ray room, both horizontally and vertically indicated. All shielding materials and thicknesses for walls, barriers, doors, windows, ceiling, and floor for the X-ray location. Indication of all safety devices such as warning lights and interlocks. And keep in mind, these are minimum requirements. I would encourage you to go beyond this, provide any additional information you believe may be helpful in understanding your X-ray machine, your X-ray source, and the shielding setup itself. All right, here is an example floor plan I have created. It's not derived from any particular room, but can you spot the errors? There are about 8 or so errors in this one, and I'll go over it in maybe 15 seconds.
You can just type in the chat or you can see an error.
But for now, if you don't see an error, I'll cover them all now. And it may be a little bit a surprise for some people, depending on it, because some of the things required are not always obvious. First off, the exposure switch location is not clearly labeled here. No north arrow. There is a north arrow here, but good try. But I'll cover all the errors now. So exposure switch location, it's just labeled as switch. What kind of switch exactly? There are a lot of switches in any building. Could this be a light switch? Could this be a power switch? Could this be a switch for another machine? So you would rather have some sort of label like exposure switch, possibly specifying it's the dental operatory for that room shown. No control panel is shown. The below adjacent space is not specified. You can see they've specified the floor materials, but not the actual below adjacent space. They've done it for the above, but not below. The X-ray tube itself, that's a good one. Whoever just commented that. The X-ray tube itself is a little bit vague here. It's a red circle. We're not sure what exactly it represents. You may wish to specify here, these are the travel limits. This is the area of exposure. We don't know right now, but it's up to the submitter to specify this clearly. You see the west door as well, an interlock door. No materials are specified for that. Obviously, maybe it just doesn't, they don't know what materials there are in that door, and that's fine. You don't necessarily have to provide it, but it means the review is going to go off of the idea that that door is made up of basically air in terms of shielding materials. North wall, I think someone just commented it. You'll notice it says 25 drywall. There's no unit of measurement there. That is a bit of an issue. The submitter cannot, well, the reviewer could not just assume, oh, that means 25 millimeters drywall, like another wall. So that would be a problem. As someone commented earlier, that blue line in the south, is that a window? Is that a door? This is not clear, this is not explicit. There's no materials for it, so we're not really sure. And then finally, someone also commented, the other door is indicated as metal. What type of metal? Is it steel? Is it aluminum? Is it lead? That would be very useful to provide. And then, of course, the room itself doesn't have any room dimensions or a scale reference line for the floor plan. This is not necessarily required explicitly, but it can definitely help a reviewer make sure that your scale drawing is actually proper. It's not just a skewed image, and they can verify the scale. And if they don't have these, they may ask you to provide them. Okay, thank you for all the comments for those. I think a lot of them were actually very valid. I see a lot of people are still commenting, and I think you've actually pointed out more errors that I didn't even mean to include. So thank you for that. I'm not sure the point of the fake street address was kind of on purpose, but I'll give you that point. But moving on, common errors that continuously come up for X-ray floor plans. Adjacent spaces missing or vague. Specify your adjacent spaces, all of them, north, east, south, west, above, and below. Even if it's something as simple as the roof is above or ground below, this needs to be specified, because otherwise the reviewer will not have this information and your floor plan will be considered incomplete. It's a requirement according to legislation. So even if you know, and even the reviewer knows, that there's no occupancy in these spaces, you still need to specify them. Street address, employer name, not matching with form. We've covered this to death a little bit at this point. Yeah, it needs to be accurate. Above and below information missing. Not only should you specify the above and below adjacent spaces, but also the floor and ceiling materials and corresponding thicknesses when possible. If you don't know, it's fine to leave it out, but understand that the review will go under the assumption that you have no shielding materials in these barriers. Shielding materials not explicit, especially doors, ceiling, and floor of X-ray source location. You need to make sure you provide all barrier materials and thicknesses. Even doors, make sure, is it a steel door like we said? Is it wood? What kind of metal is it? Is there a window in the door maybe? Or in the case of our example, what about the windows in a wall? Is there materials in there? If you do not know, you don't necessarily have to list it. But like I said before, that would mean it would go under the assumption that there's just no shielding in that particular area, which is fine a lot of the time, but it is something to point out. Safety devices and or control procedures not clearly indicated. Let me highlight that the ministry does have a policy that specifically for dental X-ray machines, all entryways to the X-ray room should be controlled via interlock or visual control. Visual control mainly by the switch operator. For your machine, you may wish to understand what is the optimal solution to safely control and shield the room openings to your X-ray location. Perhaps you need interlocks, perhaps you even need an infrared laser system of some sort, depending on how powerful your machine is. For adjacent spaces where you require a control procedure to control the occupancy, please make sure to clearly outline how this is achieved A procedurally controlled area is more prone to possible shielding issues as you are relying on a human factor over engineered shielding such as walls and barriers, where the shielding would have to actually be physically removed to have a possible shielding problem. A final word of caution I would give for anybody creating a floor plan is I would not advise creating a hand-drawn plan. It's very hard. But if that is the choice, please be extra meticulous when it comes to scale, descriptions, and proper formatting. A sketch on the back of a napkin is not ideal and is something that I'm pretty sure all X-ray application review teams have seen and probably wish they hadn't. Okay, here are my final tips for submitting an X-ray application. Review your work. Anything you catch, any mistakes, typos, omissions of information you catch early will avoid delays down the line or even a possible future reapplication. Taking just 10 minutes of your time to review what you've entered in your form, what you've drawn on your floor plan, may save you quite a number of days during the review process as revisions will come through. Provide as much necessary detail as possible to the floor plan and form. The ministry only requires the form and the floor plan when evaluating your X-ray source. However, because of that, they are limited to how they understand your X-ray source usage. They're not on site with you. They're not the ones running the machine every day. So if there's anything unclear or vague with your application, they will likely ask for clarification. This is not necessarily a problem, but it could cause unnecessary delay or even a rejection if you had just provided a clear picture of how the X-rays are working. Plan ahead. The application process takes time, even with perfect applications. Do not expect a 24-hour turnaround. The ministry has hundreds, if not thousands, of applications each year to process. Even if yours is perfect, please be prepared for a delay. This means you may wish to apply well in advance before the date of installation for an X-ray source, so you may account for any required changes to your setup before your construction starts or even finishes. No one wants to have to rip up an installed wall because it was found to be lacking. And obviously that would be a little bit more expensive than you were expecting in your budget. In the case of revisions, respond to all requests from the ministry for the best of your ability. It may happen that a ministry reviewer reaches out to you with questions, concerns, issues about your application. It's important that you respond to all inquiries to the best of your abilities. Some of the questions may seem unusual, unnecessary, or wasting your time from your point of view, but please make sure to answer all questions. They are likely asking these questions simply because there's a possibility that your X-ray source setup is unclear or may be in violation of the regulations due to lack of information. And so I will conclude my part of that. I'll now move it over to Lynn.
All right, thanks, Matthew. What I'll do now is I'll move over to the Q&A, and I see one attendee that there was a question. We move that over to the Q&A as well. We'll try to get through these as quickly as we can, and we'll go from there. So let me see, and we'll start from the bottom. So there was a question, and I think it was there on the form, of the forms are a bit small. So is there a place to enter occupancy of the X-ray installation room? Or I assume the room the X-ray's in. So the occupancy factors and things like that, is there a place to enter that on the form?
The actual X-ray room itself, is that the question?
It's if the person can clarify, it says, is there a place to enter occupancy of the X-ray installation room?
Sorry, let me.
So, yeah, I think it is probably the occupancy of the X-ray room itself. But it's the occupancy of the adjacent spaces, right?
So when you're doing this application, the occupancy rates are more applicable to your adjacent spaces in this case. It is assumed, depending on the machine itself, whether you need an X-ray worker within the room during operation. That will be assumed by the ministry itself or whoever is reviewing. So 100% occupancy in those cases, or in the case where you don't require a worker in the room, it is assumed that you're not allowing anybody to enter that room during X-ray operation. So that would be a 0 occupancy in that case.
Okay. So the next question is, when all walls within the X-ray room are covered with the same shielding, why would the shielding requirements not meet the proposed shielding requirements for only one wall while the other 3 walls are sufficient?
Okay, yeah, that's an excellent question. The problem is more based on how radiation works itself. I won't go too crazy about that. I won't go too in depth on that. That's more, if you want the nitty gritty of that, you'll want to actually have a proper radiation shielding course of some sort. This would be usually because of the main principles of radiation: intensity, distance, and time. So for example, if I was taking an X-ray room and to the north is an adjacent suite, I'm assuming those, and all 4 walls are going to have all the same shielding, as you said. The north wall has an adjacent suite, so that's 100% occupied all the time because we can't control that occupancy. Obviously, we don't know what's happening over there, and you really shouldn't put anything other than that. That's going to be higher occupancy than, say, my east wall, which is just a hallway. It's the same distance from the machine, but because it's the hallway itself, according to the occupancy factors, is in this case 20%. That would be 1/5 of the time than compared to the north wall. As such, the north wall, the occupants themselves will get 5 times the possible dosage, the estimated dosage, than anybody walking through the hallway during your X-rays, simply because they won't be in the hallway during all your X-rays. So the idea there is that the dosage has increased to that one wall. Even though you have the same amount of shielding, that wall has failed because somehow that dosage estimate is higher than permitted, while perhaps the rest of your walls is lower than permissible.
And there's also the primary, is it a primary protective barrier or secondary protective barrier, things
Yes.
like that. And then distance, you mentioned distance. The
Yes.
thing may not be right in the center of the room, right? So the formulas are quite complicated. So there's those factors Matthew mentioned, like when you have your time, distance, and what materials are there. It all factors in.
Yeah.
Has somebody spoken up there? Okay. In terms of this, do you have any recommendations for submitting forms for mobile X-rays that can move between many rooms? That's a notification to the ministry in that case, and they have, like we had mentioned earlier in the presentation, there's no floor plans if it's portable and mobile and being so used. But if it's being it's being used as a fixed X-ray, then you have to put in the floor plans. Any other comment on that, Matthew?
Yeah, mobile is something you really do work a lot alongside with the ministry themselves. What would be my recommendations about that? Just have all the information, especially regarding what specific rooms you might be using the machine itself in, and have all that information handy for the ministry because they're going to request it.
Okay. If the diagnostic imaging device, for example, SPECT, does not need shielding, do these same requirements on X-ray floor plans need to be included when reporting to the ministry? For example, your north sign, occupancy, etc.
The same requirements. Yes, basically they do. Yeah, it's basically in the legislation. I understand the question because I understand some of those machines are rather for example, some of those spec machines will actually be first approved by the CNSC, and then the smaller, maybe the CT imaging part or whatever, is covered by provincial. And I understand for a lot of submitters that becomes kind of questionable. It's like, why am I doing 2 approvals? Why not just 1? Please realize you just have to follow through with the legislation here. So all those requirements are still required. Unfortunately, that's just how the paperwork works.
Okay, the next one I can, does the Ontario MLITSD have specific guidance or different requirements for research labs using X-ray equipment compared with clinical diagnostic facilities? As explained earlier, if it's for human health care, then the requirements for shielding all of that registration goes through the Ministry of Health. So unless the lab is also irradiating humans for human health care, then that registration will be the Ministry of Labor, Immigration Training and Skills Development. I don't know if you have further comment on that, Matthew.
I'm not sure I would really want to comment on that. I would say the only thing I'd say about that is I know there's lots of training centers, for example, dentists, that, for example, if you're only doing x-rays on mannequins, it's Ministry of Labor. But if you end up doing testing on, I guess, students taking x-rays on other students, that would fall under Ministry of Health.
Yeah. Occupancy factors for outdoor areas, a wall on the 3rd floor facing exterior of the building. Why do we need to include occupancy for this wall?
It's assumed to be 2.5% according to the default occupancy factors. Why do you have to include it? You wouldn't necessarily have to include it per se there. It would be a worry if you have a very high-powered machine. It would be a worry what's the closest building outside the window. That's a very rare case, but it does come up every once in a while. For the most part, the review will just assume, right, like you said, it's 3rd floor. You're not worried about the birds outside, so it is basically going to go to probably a 0 occupancy factor. And at that point, we're not too worried about any dosage going through that wall. But obviously, there are cases where it's a very high-powered machine, let's say a CT machine in a hospital. You would have to worry about maybe a close building beside the hospital that may be getting a dosage.
And would that be, like, if there's nothing on the other side, that might be one of the areas when you're changing the occupancy factors and explaining what's going on, correct?
Yes, you could definitely, if you wanted to, you could definitely specify 0 occupancy outside the 3rd floor window. That's completely up to you, and definitely the very useful thing to do on your form.
Okay, well, just looking at the time, we have to get wrapped up. If there are other ones, we'll take them away. The one on mobile bus for dental, that's Ministry of Health. This is focused on the Ministry of the Labor. So, but we'll write up a short thing there. And in the terms with cabinet x-rays, you still have to register and follow the requirements in terms of registration, but they're a lot more basic. I don't know if you have a quick comment on cabinet before we go, Matthew.
Sorry, on cabinet?
Yeah, are there any differences for cabinet? You still have to register, you still have to have where things are located, but the shielding's on the device itself.
Yeah, I don't really comment too much on cabinets. Obviously, you would hope the cabinet itself has the proper shielding such that you're not worried too much about what's outside of it.
Yeah. So, all right. So with that, we'd like to thank Matthew for being here. If there are further questions, we will take them away and write them up and put them on our website. And when I email out, we'll have that Q&A ready. The resources we mentioned, that these will be linked out in the PDF we send, but the Government of Ontario has a page about registering, guidance for the application form, and then the form itself is linked at the bottom. We also have some resources that one of our scientists put together a couple of years ago, and so there's detailed application support with a guidance document, training video, and a free e-learning course on it. And then there are free X-ray safety templates for Regulation 861 also on our website. So if you have any questions about any radiation safety topic, please feel free to contact us at the Radiation Safety Institute of Canada. We have a toll-free information service to support questions from employers, workers, and the public with respect to both ionizing and non-ionizing radiation safety. We also provide consulting services for those that might need support in developing a radiation protection program and related services, including radiation surveys. If you have any further questions about ionizing or non-ionizing radiation, please feel free to call 1-800-263-5803 or email info@radiationsafety.ca. You can also visit us online at radiationsafety.ca. Find us on Facebook, LinkedIn, and YouTube. So with that, one thing that before we turn it over to Charmaine, that we are working on an annual health and safety breakfast. We are in the preliminary stages of planning. We'll be working in partnership with the Workplace Safety and Prevention Services, WSPS of Ontario, because the stakeholder audience overlaps strongly with those registered for the webinar. I'm going to be sending out a survey to everyone to see what topics would be most helpful to cover at the event. So we're looking up, it's probably going to be hybrid. So even if you can't attend in person, that if there's a topic in terms of radiation protection you'd like to see come up in September at this breakfast event, please look out for that survey. So thank you to everyone who took the time to join us today. We're now going to move to our 20-minute wellness break in the form of beginner Tai Chi led by Charmaine Wong of P.Eng Tai Chi in Qigong in Richmond Hill, Ontario. So welcome, Charmaine. We know that a lot of people have to go because we ran a little bit over time as your lunch break ends, but we appreciate people participating as you can because your whole body and movement and things like that, especially if you're sitting all day in an office, it's very important to get up and move. So again, thank you, Matthew, and I'll turn it over to Charmaine.
So hi, so welcome everybody for this Qigong and Tai Chi exercise. All right, so now let's get started with standing up and having a good posture and some warm-up exercises with your feet shoulder width apart. All right, now let's start with our first movement. You just interlace your fingers, palms facing up. Bring the hands up to about chest height. And now you extend up. You can look up to your hands, but don't arch back and not leaning back. And as you look back to the front, you can open your arms, come down a little bit, bending the knees as if sitting on a high chair, and then we can repeat from there. Now you want to feel very relaxed. Just have a very soft stretch, very comfortable. And then you just open the arms and come back down a little and exercise the legs a little by having a high squat. And then we do that again. Now you can add breathing to it as well. So when you bring the arms up, you breathe in. And then you start to breathe out as you bring the arms back down. Now the type of exercise that we do here, Qigong, Qigong, means working on your internal energy. So we're slowly moving our arms and body, smooth, relaxed, extended manner. And together with breathing, you will feel a very good circulation of energy within the body. Breathe in, breathe out. So that's a big characteristic of Qigong, where we do movement slowly, continuously, relaxed. Breathe in again as you reach your arms upward, and breathe out as you come back down. Just one more time, and we'll switch to a different movement. Again. Breathe in. Breathe out. Okay, all right, now just relax, all right? Now we switch to a different movement. It's very similar to the previous one. It's just a little bit more interesting to switch it around a little bit. Now the next one, with the palms still facing down, you bring the arms up the sides initially. When they're over your head, you turn the palms towards each other, draw the elbows down in front of the body and sit down the same way. And then we do that again. When you draw the arms down, elbows down, make sure the shoulders are relaxed. You don't want to be raising your shoulders, hunching forward. You keep your body in a very expanded yet relaxed manner. Breathe in. Breathe out. Let's just do that 2 more times. Focus on the sensations you get from the movements within your body. One last time. Okay. All right. Now, so that's more of a warm-up exercise. Now we're actually getting into Tai Chi now. So Tai Chi has a lot of similarities with Qigong, where you do movements slowly and continuously as well. But when you get more advanced in Tai Chi, there are a lot more to learn and a lot more skills for you to practice on if you're interested in it. All right. Now, so first of all, the first movement that we're going to do with Tai Chi is called cloud hands. In terms of cloud hands, it requires a stance that we call a horse stance. I kind of briefly mentioned that earlier on. So this is really like a squat, right? Similar to a squat, but you can just stand up a little bit taller. All right. So you don't have to go down very low. I'm going to show you a side view. You would want to feel like you're sitting on a high chair. You don't want to lean forward too much or lean back or just sticking out your knees like that. You want to still feel like you're going to be sitting on something. Sometimes we just sit there for a while and just to train up our focus and also to train our lower body. You can feel that it can be actually a little bit tiring to the legs. So this is how you build up your muscles in the lower body, your strength as well. All right, so this is how you would be doing your horse stance. All right, now, and then in terms of cloud hands, we use this little bit of a high squat to move as well. So for cloud hands movements, in terms of the lower body, we step sideways. So let's just practice our stepping. So you step sideways, any one direction. All right, so keep sitting down a little bit so that you can continue to train on your lower body. So every time you step, you want to put the toes down first and then the heel. One more time to the same side if you have the space. You can go back to the other side. The way you shift your weight is also a good training. You don't want to be leaning or rocking side to side like that. You want to be going like this. You want to keep your upper body steady. That is a little bit more challenging to the lower body. Everything's kept upright as you move sideways. All right, just a little bit more back to the middle part of the screen here. Okay, all right. Now, in terms of the movement called cloud hands, it requires a lot of coordination of our hands moving, all right? So it looks like this. One hand is higher at about chest height. The other hand is lower at about waist height. The upper hand, higher hand here has the palm facing your own body. The other hand is towards the ground, all right? So now we also switch the hands around. So we bring the other hand up and we lower the other hand, all right? So the same way, every time you bring a hand up, the higher hand with the palm face facing yourself and the other hand with the palm face facing the floor. And you switch. And you switch like that, okay? So it's like this hand here higher up is like a cloud floating in the sky when you start to shift weight, right? So we shift back and forth. When you're shifting to your left side, the left hand is the higher hand. When you're shifting to the right side, the right hand is the higher hand. So you really need to focus and think which hand should be on top when you're moving side to side. All right, now you can start to see if I start to add my footwork, how this is going to work. Now let's say we just move to one side. Let's say go into this side, it's my left side here. You step, and then you bring the other foot closer. Now when I'm actually moving my weight back onto the right in order to lift my left foot, my right hand is on top. And then when I step, I bring my left hand back up again. So even though my feet are moving to one side, my body is shifting weight side by side. So my hands are switching up and down together with the weight shifting. All right, now let's go back to this side. I'm stepping, but I'm also weight shifting. Stepping, weight shifting. So after a while, it may be a little bit challenging to keep the coordination working, but this is a very good training to the brain as well, because you have to use your brain to think which way I'm going. Your brain directing the movements of your limbs. That's a very good training to your cognitive abilities. All right, so you just move side to side. All right, so if you ran out of space on one side, for me, I'm going to go back to the other side. But every time, even when I'm stepping onto one direction, my weight shifting is to the opposite direction. So your hands need to keep changing. I hope you're having fun there. All right, now I'm going to just do a final round, stepping back to the opposite direction. I'm stepping, weight shifting, stepping. Every time you move your feet and your hands in coordination, and you keep your high horse stance, so you get your muscles in the lower body trained as well. All right. Okay, all right, so if you remember this, you can practice it on your own, all right? Now I'm going to add another move towards the end here, just to make it more fun for you to try different things, all right? Now this one requires the lower body doing something called a bowl stance. So it's almost like a lunge, right, in your gym exercise. One leg in front, one leg at the back. The front foot always points to the front. The back foot always points 45 degrees out. Side view. The back leg mostly straight. The front knee is slightly bent. You'll keep your upper body upright there. All right, so this is how you want to keep your bow stance. You can have it on the other side as well. So again, you will feel that it requires a lot of lower body strength, or you can train it up by doing these stances. Okay. Now, so when we step out one foot, for example, we're going to turn one set of toes. Let's say I'm turning my right toes here. And then I'm going to step forward the other foot into the bow stance. And then I can switch it to the other foot, turn the toes out first because that would become my back foot. And the other foot, as you step forward, the front toes will face the front with the back toes out 45 degrees. Okay, let's do that one more time on each side. And then back to the other side. You want to hold your balance here and step out as lightly, as slowly as you can, then you shift weight there. That's, again, more challenging to the legs. All right, now we're going to do one move, which is called parting while horses mane. I know that we don't have too much time, so let's try as much as we can. We first start with something called a holding of a ball, as if you have a ball between the palms, right? So the top palm has to face down, the bottom palm facing up in order to hold the ball in the middle there. With this side, like say in this case, my right hand here on top of the other side, we call it a right hold ball. And that's when we do turn out the right toes. Okay? So when we step out the other foot, we're going to extend the lower hand and bring it up as if we are holding onto a tray, serving a tray of drinks to this person in front of me. All right, so we'll do it on the same side. If this is your right side, you put your weight entirely on that 45 degrees foot. And then the right side would be have right hold ball. So when I step out to the bow stance that we were just practicing, the lower hand would bring the tray up and serve it to the front. The other hand would just put it on the bar table for balance. All right, so that's what I'm thinking about right now. So you don't have to think about it that way. We can just serve up your breakfast or something. Bring it down and put it on a breakfast table. All right, the other hand. All right. Now, so we can do it on the other side. Left hand, left foot. When my weight is on my left leg, I would have my left hold ball with the left hand on top. The other hand at the bottom. So here it goes. Your food. The other hand just put on the table. We'll do it again. Slowly put out the other heel. Go up. And bring it up. Okay, now let's do it one more time on each side. Or maybe a couple more times on each side. And then we can finish with a brief cool down. And go. So you can also see that this movement requires a lot of coordination of the body. And you need to think about the whole ball, which side you're holding the ball, so that you can move your arms very smoothly. All right, one last time. My weight goes onto my left foot, so my left hold ball, left hand on top. The lower hand then serves up the tray of whatever. All right, one more time. Left hold ball, holding onto that tray, bring it up. There we go. All right, so hopefully it wasn't too hard to follow. So it's just a good challenge to your brain, all right, and your body as well. Now let's do a cool down now. So we'll just do 3 circles and some breathing. Bring the palms up the sides. Breathing in slowly. Pressing down, breathing out. Movements are slow, continuous, relaxed. And bay, extended but not stiff. Breathing in. Breathing out. One more time. Okay, so that concludes today's session. So I'll turn it over to you, Lynn.
Thanks so much, Charmaine, for being here with us. And we thank everyone who's able to stay to the end for still being here. And we see everybody again next time. Have a great afternoon.